All right. So we're looking at a condition which is known as what? Hydrosalpinx. Hydrosalpinx. Now, salpinx is, I wonder why they are calling fallopian tube, because if you start talking about the medical conditions of fallopian tube, this is the same fallopian tube, they start calling it a salpinx. Do you understand? So, for this hydrosalpinx, is a condition where one or both of the fallopian tubes, they actually become blocked. All right, and this is maybe they are filled with fluid, so this often leads towards infertility. So the term comes from the Greek word hydro, which means water, and salpinx means a trumpet. Of course, it's because the fallopian tube looks like a trumpet. Okay, so causes, it could be due to pelvic inflammatory diseases, right, often from sexually transmitted infections. It could be from endometriosis that can cause scarring and inflammation. It could be previous pelvic or tubal surgeries, it could be ectopic pregnancies or the ruptured appendicitis. It could be tubal tumors or genital tuberculosis. So what's the symptoms? When present, the woman is having a lot of pelvic pain, lower abdominal pain. There are some unusual discharges from her vagina. She's having pain during menstruation or intercourse. Right. Impact on fertility. It can block sperms from reaching the egg. Fluid may leak into the uterus, disrupt the embryo implantation. All right. So there's a risk of ectopic pregnancy and miscarriage. Okay. So diagnosis, they might want to do some 1 or 2 imagings just to look at the fallopian tube if it's okay. So Hysterosalpingogram, right, ultrasound, Laparoscopy. All right. So treatment, they might actually want to do what? Salpingectomy. This one, they totally remove the affected tube. Then salpingostomy, that one they open and rather drain the fluid. Then what again? IVF often recommended, as what? In vitro fertilization, often recommended after treatment to bypass the tubes. Sclerotherapy is just experimental method to drain and seal the tube.